I'm Adam Knight-Matikieki from MAR Research and have been the lead evaluator on a pilot project in Barnsley funded by Macmillan. They funded a high-level nursing role, Advanced Specialist Practitioner, ASP, as it's known in this presentation, to support better end-of-life care for care home residents in care homes, as well as engaging with GPs and community health teams, championing care homes and good end-of-life care for their residents. The role sits within the South West Yorkshire Partnership NHS Foundation Trust in Barnsley. This has been a 2-year evaluation, started in late 2019 and running into 2021, focusing on whether the pilot project is helping to improve high quality end-of-life care for residents, whether it's supporting a more integrated system, and whether the role was sustainable after the end of the Macmillan funding. Of course, much of this is taking place against the backdrop of COVID, which has hit care homes particularly hard, especially in the early phase of the pandemic. In fact, the support provided during this time by the post holder to the care homes was highly valued, including the emotional support provided to care home staff and others. The pandemic has had one positive outcome for care homes, though, highlighting the need for advanced and more proactive end-of-life planning. So when speaking to care homes and wider stakeholders, we asked what they see as high quality end-of-life care. So you can see here lots of different things came out. This encompasses many elements, including identifying somebody earlier at end of life, so with months or even a year left of life, rather than simply days and weeks, but also by including residents and family members in decision making and ensuring there's a beautiful death at the end when it does come, as one person said. So our evaluation found repeated signs that care home residents were being identified earlier, such as high numbers with the electronic records, EPACs as it's known, helped by the use of the gold standards framework. A high proportion of these residents had future plans in place, whether or not they had mental capacity affected by dementia, for example. The strong emotional intelligence from the ASP post holder supported involvement from families and others in this future planning, even during lockdowns, and sometimes when there are kind of torn kind of issues as well, and kind of dilemmas for families. Some residents did die during the evaluation, but a really powerful statistic is that 95% of those died in their preferred place of death where this was known. That's a really high proportion there. So other statistics also paint a positive picture. One set looked at unplanned emergency hospital admissions. We can compare the 6 months before the ASP was involved in a care home with 6 months afterwards. So although COVID will or may well have played a part in this, we do see a big difference between those two time periods. Before the intervention, there was an average of just under 1 admission per resident per month. This fell to just 0.16 admissions per resident per living month in the 6 months afterwards. So that's just a sixth of the level. So translated, this is almost the difference between 7 unplanned admissions per week beforehand to just 1 afterwards. There's a lot of praise for the ASP herself in supporting high quality end-of-life and personalised end-of-life care. She already had previous experience with care homes in Barnsley, so that was a good starting point, was good at providing support and that ongoing reassurance. She was there at the end of the phone if somebody needed her. And there was also support provided by others within the wider enhanced care home team, including the end-of-life facilitator. So moving on then to an integrated system, it was clear but also great to see the ASP role championing care homes and their residents. That was across GPs, primary care, community services in Barnsley, with commissioners as well as clinicians. So alongside this, both COVID and GP alignment have helped to better connect primary care with care homes. So GP alignment, that's attaching one GP to particular care homes and their residents, but also the multidisciplinary team meetings, the MDTs that have taken place, has put more focus on care home residents, including those at end of life and the coordinated care around that. So the ASP has been an important intermediary within this. There was a lot of praise too for the education and training provided not just by the ASP, but the wider enhanced care home team too at Swift, the Community Healthcare Trust. Tools like the gold standard framework particularly help to identify if somebody is at end of life and at what stage that diagnosis is, but also practical support like oral health were welcomed. All of these help care homes to feel more empowered and more confident. So some really positive changes, positive words coming out of care homes and their staff. So the third area we looked at in this evaluation was sustainability. So really it's about whether there's a long-term future for this role, and if so, should it be supported and how? So lots of people described a legacy, something lasting from the project. So this included better relationships between GPs and care homes, real positive there, and a greater focus on advanced care plans. So again, not just those final days and weeks of life. So as I've already said, the gold standard framework is a key tool, although it's not embedded in all care homes in Barnsley. So there is some work to be done there. And again, because of the high turnover of care home staff, training needs to be continual, re-educating staff on an ongoing basis. A little bit like painting the fourth bridge, as one of our stakeholders said. But yes, most people did feel that there was a need for a dedicated role to continue championing care homes, to provide specialist input with enough time with residents, staff and family members. So to bring things together, so our evaluation has shown better end-of-life outcomes for care home residents through this Macmillan-funded project, this ASP role in Barnsley. There's been more advanced planning and quantifiably fewer avoidable hospital admissions. The post holder has championed care homes and their residents and supported better relationships between care homes, GPs and wider healthcare services. So certain tools have helped with this. So we've said about the gold standard framework repeatedly, but also the education and that reassurance provided by the ASP, and that support by the wider advanced care home team in Barnsley. It'd be great to have this in all areas beyond Barnsley. Sure, there are challenges too, including providing such a service across the whole of the authority, the whole of Barnsley, but also with longer term planning, not just in the final few days of life, and embedding this culture in an ever-changing care homes with that high turnover of staff. We've shown that a dedicated resource is highly valued, is needed in future, and has delivered some great end-of-life care in care homes. Thank you.